Sometimes I'll hear from people that is what I eat that important, because I exercise very vigorously and my body looks great and I'm ripped and I'm very muscular and so forth. The problem is with that is the data shows that in terms of exercise, if you took somebody who eats poorly or eats a standard American diet with lots of meat and dairy and fat and exercise, you can actually reduce their cardiovascular risk somewhere between 8 and 15% by exercising alone. So there is a benefit in exercising. In other words, if you're unhealthy and sedentary, unhealthy in your diet, I mean, and sedentary, that's bad. If you're unhealthy in your diet and you exercise, that's slightly better. But the best approach, of course, is focusing on your food, because if you exercise, you'll get the 15% reduction in cardiovascular risk. But if you focus on a whole food plant-based diet, you can reduce your cardiovascular risk. Conservative estimates between 30 and 70%. Some smaller studies estimate more than 90% reduction in risk. So you can't really exercise ahead of a bad diet. And sadly, you know, many of us have heard so many cases where very fit, very healthy looking people on the outside finishes a marathon and then drops dead. And it's mainly due to the fact that those people, again, were thinking, I suspect, that we can exercise ahead of poor nutrition. But you really can't. Your nutrition determines how your vasculature is, how your organs are functioning on the inside. And you can feed your body somewhat poorly and get away with exercise and still look fairly fit, and yet be hiding very significant cardiovascular problems that may only show up you know, suddenly when you rupture one of the plaques that you didn't even know was there. So, so we don't recommend people vigorously exercise and ignore their nutrition. We also don't recommend people eat perfectly and stay on the couch. You know, exercise is critically important for health. I personally think, and based on my read of the literature, is that exercise is really nature's natural antidepressant and anti-anxiety approach, which I think is really important for nutrition, because if you're anxious and depressed, you're going to find it really tough to motivate yourself to stay on track and meal plan and properly shop and grocery shop. So it's hard to extract any one particular facet of this. If somebody's not feeling well, they're not going to feel motivated enough to take care of themselves. But if you actually look at how many miles on your treadmill you need to run to burn off like a dozen chocolate chip cookies, you'll quickly realize that you can't be too loose with the chocolate chip cookies thinking that you're going to exercise ahead of it, because especially today's food and today's junk food and processed food, it's so chock full of calories and fat. It's so energy dense that the amount of regular exercise you'd need to burn that stuff off, you'd need to be exercising 8 or 10 hours a day in order to burn it off. So it's something you can't ignore, nutrition under any circumstances. Some exercise is good to help maintain or improve your mental health, but they need to be both addressed. But I often get pressed, which is more important, food or exercise? I'd have to say food is actually king, but exercise is a very close second, mainly because of exercise's ability to improve your mental health, your anxiety, your sleep quality, and your overall quality of life.